Dr. Chang, hospitalizations are going up all over the country. I'm going to guess that it's happening at Parkland too. A few weeks back, you told us right around Christmas you had a certain number of patients in the hospital. Where are you right now?
Yeah, so way back when seems like golden years now. But back then we were talking about 30 to 40 patients at any given time, and today we're up to 270. And that is active COVID patients. We have another 50 convalescing, so we're talking about 310 to 320 patients total here, either with active COVID infected now or still trying to recover from the ravages of the disease. So it is certainly a giant problem. If you look at that total, I mean, that's over a third of all of my beds. Over a third of all of my beds are now taken up by COVID patients. So it's becoming a insurmountable challenge almost.
You know, when we used to look at the data, we used to say, okay, this many people vaccinated, they are protected, and this many people have natural immunity. That doesn't really seem to be the way we look at data anymore, is it? When it comes to the battle against ending this pandemic, because people can get, reinfected, or they can also get a breakthrough case.
Yeah, one of the problems, of course, of this kind of a novel virus is as it mutates, it becomes yet another novel virus. And so we, again, have decreased immunity to it. And I think this is what we try to avoid by trying to get people to be vaccinated the first time around. You'll recall that we actually had the availability of a perfectly good vaccine that was 95, 97% effective in December of last year, right? So not this December, but the year before. That was before all of these variants came out, the first UK variant and then the Delta variant and now the Omicron variant. I would remind everybody that we had access to a perfectly good vaccine months before any of these variants came out. And if we were successful in getting 85, 90% of folks vaccinated fully, these variants likely would not have even existed, much less hit our population as hard as it has.
But you're also talking about needing to vaccinate the entire world, 85 to 90%. Is that realistic? Well,
actually, that's not true. So the interesting thing is that, these kind of things are population dependent, right? And so let's go back to that now quaint term of herd immunity, right? Your herd is not the entire world. Your herd really is your community. If your community is 90% vaccinated, that disease has a very hard time getting into your population to begin with, because there's just aren't that many available people to get infected. And so that's why we keep seeing this issue, is because we only have 55% of folks fully vaccinated. And so there's always an ample supply of folks who don't have immunity for new variants to both develop and then invade the community. So I would again put out there that the sooner we can get a large number of people vaccinated, the sooner we can get rid of the constant birth of these new variants.
It seems like this week there's been a bit of an elephant in the room when we talk about vaccines. CDC saying eligibility for a fourth shot. And a lot of people weren't or still not okay with just one shot. How do we convince people that a fourth one is going to do the job?
Well, a fourth one won't do the job. Okay, so here's the reality of this, is that the folks who keep getting boosted, right? So it's the two and then the one booster, and let's just say, it's been 6-8 months, whatever, and hey, let's get a fourth one. Well, that individual's doing really well, right? That individual's going to have really high antibodies, right? But from a community standpoint, it hasn't changed anything, because the people who are getting boosters are the people who are fully vaccinated to begin with. You see, so from a community standpoint, we're not really moving the needle very much, because it's the same people that are already protected that are getting even more protected. The folks who aren't protected still aren't protected.
We keep seeing the numbers elevating in the number of cases. Dallas County had something like 12,000 cases over the course of the last 3 days or so. how accurate are these numbers when there's so many people taking at-home tests and they're not necessarily reporting their positive status to the county?
Oh, absolutely. Our county numbers are underestimates. That is without question. We know there's going to be far more actual disease in the community than what we're picking up on those county numbers. But at the same time, the exact number is not even necessarily the important thing. I mean, the important thing is to realize the slope of growth of these cases. The percent positivity actually tells us a lot as well. Just to again give a little bit of perspective, before Delta, so the first wave or two, we felt that a high positivity rate, meaning if you had symptoms and you went and got a COVID test, what is the chance that you have COVID versus just having a cold or whatever? Back before Delta, high was considered 15%, maybe 20%. Delta got up to 25 to 30%. Okay, now we're talking about 60% plus. Okay, so what that means now is if you have sniffles, you have a 2/3 chance that's COVID. That's a tremendous number. We've not seen that kind of a positivity rate in any infection that we have record of. Think about that.
Absolutely. I mean, it seems, as somebody who's not in medical profession, everybody I know has, COVID or just getting over it, or, whereas that was not so much the case a year ago. You hoped to not know anybody who had COVID. Now it seems like, oh yeah, girl, I just got over it. We're good now. We quarantined for the week. But there are so many schools this is affecting with schools having to shut down because people are quarantining. Is quarantine still the best option for the amount of time? I know it seems like it's been lessened, but I think the last time we spoke, you said it was more so just to kind of make some people happy. What are you seeing from the people who are coming into the hospital? Did they try to quarantine and do some self-treatment before coming into the hospital saying, hey, this is not working?
No, actually, we're probably seeing the same types of folks come into the hospital. The population that's getting this variant is pretty similar to Delta in that it's younger. It's still not our older, sort of over 65 individuals, which again points to the fact that we've done a really good job of messaging to the 65 plus age group about getting vaccinated. And so again, you've heard me say it on your show many times, again, the largest growing demographic of Omicron infection is 18 and under. Here we are again. And as obviously schools open after, Christmas break is now over, you're going to see that number really start to go up for sure.
We talk about the Omicron variant all the time. Are we forgetting that Delta is still pretty predominant around here as well?
So the interesting thing is that Omicron really has taken over. The percentage of Delta right now is pretty low, on the order of less than 10%. We believe that Omicron is over 90% of what we're seeing. There's a lot of data to back that up. Number one, just the genetic tests themselves, but also what we're seeing in terms of the disease patterns. We are seeing less people in ICU. Points to the fact that we're looking at a less severe virus in general. We're seeing a much higher positivity rate. Again, it tells us that we're looking at a much more infectious variant. And so those, again, all pointing to the fact that it's almost all Omicron at this point.
Curious about Parkland has a specific service for long haulers. Mm-hmm. And is that becoming a little bit more popular right now with this COVID surge? Are we seeing also more people who still haven't regained their senses after losing them from being infected with COVID?
Yeah, so we are seeing a lot of long haul, but this is mostly still the ravages of Delta. As David was alluding to earlier, the long haul ones, the majority of them are really still Delta. That said, Omicron patients haven't been around that long yet, right? We haven't even reached the peak of Omicron yet. This is really just a sort of a 2 to 3 week process. We would not expect to start seeing long haul COVID from Omicron until this week, and then into next week. We would expect to start seeing some. Now, again, knowing the features of Omicron versus Delta, I would expect a much lower number of long-term COVID effects. But again, are you willing to roll the dice and guarantee that you're not going to be one of them? Because there's still going to be some.
Speaking of which, there's studies that are coming out that people are kind of looking at this saying, maybe we should just get the Omicron and,
Right.
and get it over with. A story in CNN talking about why you shouldn't be doing that. We've seen things like this before with like chicken pox parties and other health issues that you try to get everyone to get it. And then finally, when you get over it, you're done.
Yeah, I've heard that in many different places, not only here at the hospital, but even among my friends. And they sort of ask me if that's a good idea, and I tell them unequivocally, I tell them no, that is not a good idea, because again, I feel like I'm broken record, but I'm going to say this again. You have no idea as an individual person whether you are going to be the unlucky one and draws that lottery ticket, that you're 30 years old and you're the one that ends up with permanent disability. I will tell you a story from this week. A 33-year-old woman, pregnant, otherwise completely healthy. Within a week, intubated, and another 2 days, we're talking about all kinds of life-saving techniques. And because she was pregnant and had such a severe level of disease, baby was born 3 months early. And now that baby is now struggling to live. Ladies and gentlemen, this is a real problem. You have no idea whether this is going to be you. Chances are it's not. But are you willing to roll those dice? Because you get one life to live. That's it.
One more question I have, if I may, is we haven't heard too much about the flu. We've heard the combination of people coming down with both the flu and coronavirus. How is the flu going right now? Have you seen or heard numbers?
Yeah, so the flu this year is much higher levels than it was last year, and that's because a lot of the infection control sort of protocols have been relaxed a lot this year. You'll notice that there are no travel bans at all, pretty much. Everyone's kind of going where they want. And so the flu is able to transmit a lot more than it did last year. It's not nearly as bad a problem as it was, say, 3 years ago, pre-COVID, but it's definitely worse than it has been. There have been several cases, but here and throughout the city of folks having both. That's not a good situation. It really isn't. But thankfully, we have not seen that fluvid or flu-rona or whatever you want to call it is necessarily worse than COVID on its own. So at least there's that one silver lining.